It's 7 a.m. from Fox 35. This is Good Day Orlando.
Doctors are seeing record numbers of flu cases, and we're not even at the peak yet. Coming up, what doctors are saying worries them the most during this flu season.
Time now 7:07 and a health alert. A new warning from doctors after an 11-year-old boy in Bradenton died of rare complications from the flu. Tony Garcia got sick in November and was then diagnosed with a rare form of pneumonia. But now we're learning doctors are seeing record numbers of flu cases, and we are not even at the peak season just yet. Doctors at CentraCare say as of last week, they saw 793 cases of the flu. During the same time last year, it was about 200 cases, and about half of the cases at CentraCare are children. Dr. Jamin Brahmbhatt from Orlando Health joins us now with more. Good morning.
Andrea,
nice to see you again. So how common are these complications that we're hearing specifically from this case?
Yeah. So Andrea, I first want to send out my condolences to the family that lost their son this weekend. He's actually one of 3 children in Florida alone that have died from complications from influenza, and he will be one of thousands across the nation that will die from this disease. Flu overall, most healthy people like us, if we get the flu, we're able to survive it. Our body's able to tolerate it and fight it. But there are certain high-risk populations, high-risk individuals that will be at risk for some of these complications, and those include children, anyone over the age of 65, pregnant women, and 2 groups which have lots of chronic diseases. If you have a lot of medical problems, or if you're immunosuppressed, so there are certain immunologic diseases that you may have that may make you more prone to this virus.
I guess as a parent, if I were hearing this story, I would be worried if I've got a reasonably healthy child, if they come down with the flu. I don't know about the extenuating circumstances when it comes to the 3 specific cases in Florida, but I know when we're talking about a compromised immune system, it can definitely end up like this particular case.
Yep.
Okay, let's talk about who is at highest risk for this.
Yes, so as we mentioned, those five groups are at highest risk.
Okay.
So what are some of these complications? So we see in this case death is probably the most extreme complication, but some of those could also be including exacerbation of your asthma. It could be pneumonia or really severe bronchitis. And once again, most flu is kind of like presents like your common cold.
Right, you don't feel good.
You don't feel good. You may have a runny nose, cough, but what happens different in flu is that it happens really fast. So it's almost sudden onset with a high fever. So if that is the case, then you're at risk for those complications. And in those cases, we always recommend that you should go see someone and get evaluated as soon as possible.
Okay, let's get to the steps as far as prevention goes.
Yeah. So prevention is key. To understand the steps, you need to know that flu is kind of spread through your mouth and through the air and droplets in the mouth. So the 5 steps that I've come down with is 5 things. 1, I already mentioned, you should go see a doctor as soon as possible if you're having any of the symptoms that we've mentioned earlier. Number 2, cover your mouth.
Yes, that is so important.
It is. If you're coughing, sneezing, or you're sick, cover your mouth, because not only are you helping yourself, but you're helping others around you. Number 3, wash your hands.
Yes.
Tons of research has shown that by just washing your hands, you're able to kill off that virus. If you don't have a sink in front of you, then carry around a bottle of alcohol-based hand sanitizer. It does the same thing in helping prevent the flu overall. Number 4 is basically stay away from large crowds during high peak seasons.
Which would be now.
And number 5, which I think is the most important, is get a flu vaccine. There's tons of literature out there that has shown that there's almost a 70 to 80% prevention when it comes to a lot of these complications in kids and adults, in adults that get the flu vaccine. So it's not too late. The vaccine this year, if you've seen in the media, is not perfect, but it's better than getting nothing. So even though it's the holidays, you can go to your local pharmacy and get a flu vaccine. It's never too late to start preventing the complications.
Dr. Brahmbhatt, thank you so much. Some great advice. I hope to see those numbers lower next year.
Absolutely.
For sure.
Thank you.